If you are a new nurse, the chances are you're going to make mistakes. But if you know what to look for, there are so many things you can do to be able to avoid those mistakes. Let's break down the top 5 mistakes that new nurses make and how you can dodge them like a pro. The very first mistake is not asking questions. As new nurses, there are so many things that you are going to come up from class and you're going to be thrown on the field that you will be so blank and you're going to be unknowledgeable about. And so if you're that new nurse who is not asking questions, then there is a question mark as to the future of your career. As a seasoned nurse, 4 years going, I always advise new nurses to always ask the questions. Irrespective of how stupid or awkward it might make you feel to other nurses, it is always safer to ask questions so that you can clear out your doubts rather than claiming that you know and causing the life of a patient. Let me repeat it one more time. It is much more safer to ask questions and be clarified on what you are doing than claiming that you know and then you go and make a mistake that might cause the life of a patient. Let me give a very typical example. So many nurses out there might claim that they know how to maybe start a feeding pump, whereas they're very clueless about how to go about it. They might go get the wrong setting of the tubing, or they might fill the wrong food or water in the wrong bags, and because they are thinking that I don't want to ask other people and then seem like, oh, but you learned this from nursing school, how come you cannot remember it on the floor? Let me tell you one thing, you nurses. Classroom knowledge is very different from real life application. There are going to be so many things that you learned in nursing school, which I know that you might have practiced them during your clinicals or maybe when you were going to the hospital and you were shadowing the nurses, but it's going to kind of be volatile when you hit the floor. When you hit the floor, it is going to be that moment where sometimes you will feel like, I can't remember whether this one goes here. Let me tell you something. When you leave the classroom and you hit the floor with live patients, you are going to find it very challenging if you don't ask questions. Take, for example, I remember the very first time that I had to ask a senior nurse how to set up a feeding pump. One of the reasons why I did that was because, one, I didn't want to seem stupid in front of the patient, and two, I didn't want to make a mistake that might cause maybe something to happen to the patient. Maybe the patient can aspirate instead of taking maybe the feed, the patient is instead taking water. The patient might be malnourished because they're not getting enough nutrients from the tube feed. If you don't know, some of the tube feeds are going to have like 2 bags. There's one bag where you put the food, there's one that you put water in it. Now, if you don't know the correct one to put food in and the one to put water in, you might be unconsciously feeding your patient with just water as opposed to food. So always ask questions. Always ask questions. If you have a medication and you are doubting like, hey, this medication has been prescribed for blood pressure, the patient's blood pressure is this, what do you think? What is your opinion? There are going to be other questions that, hey, a seasoned nurse might clarify your doubt or make you to reason it out as to why they think that you should go ahead and give this medication. Take, for example, a patient is comes to the hospital and has a history of CHF, or maybe the patient is there for an acute onset CHF. And the patient needs to take their Lasix because they have a cough, they have edema, which is typically the reason why a patient should be on Lasix. But again, the patient's potassium is on the low side. Again, the patient's blood pressure is on the low side. Then you'll be asking yourself, okay, this medication I know is safe for me to give it for the patient because of CHF, but if you're not seasoned enough, you won't remember or you won't know that, hey, the patient's potassium is on the low side, and again, the patient's blood pressure is on the low side. So always ask questions. New nurses, make it a habit to always ask questions. I am that nurse that even 4 years going on, I still ask questions. I have seen my church nurses still asking questions. I have seen seasoned nurses still asking questions. I remember a time when they had ordered for an enema lactulose for a patient who was having a distended belly and they were having elevated lactulose, and this patient also had erectile tube in. Now, when I handed report, the medication had not yet been verified by the pharmacist, and so I had to give this medication to the oncoming nurse who was coming on. And the very first thing the nurse asked me was, how am I going to give an enema to a patient who already has erectile tube? I think this nurse is like 50 something years or 60 something years, and I know she had told me that she has like maybe 20 something years experience as a nurse, but again, she had never given an enema through erectile tube. So I, with my 4 years experience, I had to come on to show her how to administer that enema through the rectal tube. Now, this is me saying that always ask questions. You as a new nurse, there's plenty of things I can assure you, I can guarantee you that you do not know. But I can tell you that it is very normal. You don't need to be ashamed. You just have to be open. You just have to, have a very friendly manner of approach in asking questions. Make friends with elderly and seasoned nurses out there, so that when you approach them and you ask them this question, it's going to be very easy for them to explain things to you. So always be in the comfort zone of asking questions. The second mistake that most new nurses make is not double checking themselves. I can tell you that there are certain medications that will have very similar spelling of the names, and so you can mistakenly give a medication for a wrong indication in the patient. I'm sure so many of us can still remember the story of that nurse who gave a wrong medication to a patient thinking that it was a certain medication just because they had almost a similar name spelling. Please always double check yourself, especially when it comes to medications, especially when it comes to things that are life-threatening, medications that can, tamper with the patient's blood pressure, with the patient's heart rate, with the patient's oxygen, with the patient's mentation, maybe can cause the patient to become septic, medication that can paralyze a patient. Always make sure that you are double checking yourself. If you doubt what a medication is, always ask. It goes back again to the very first point. Always ask. If you feel like you are not comfortable administering a medication because you have questions at the back of your mind, always ask. Always double check. Find someone who maybe you can always go to and be like, hey, I have this medication to give for this patient. This patient has this indication which I think that the patient should be receiving this kind of a medication. Do you think that this is the right medication, or do you think that this is the correct dosage? Do you think that this is the correct route? Do you think that the previous dose was given at this time, and so it is correct for me to give this next dose at this time? Always double check yourself. I can tell you that doctors are human, and so you don't want to hold them kind of like above not making mistakes, if you understand what I mean, to say that, hey, whatever the doctor has prescribed should be the right thing. I can tell you that there have been times when I have caught kind of errors that doctors have put in, and it is up to you, the nurse who knows what you're doing, to be able to be like, I don't think that this is the right medication for this, or I don't think that I should give this medication for this patient because of this. Now, take for example, a patient is in the hospital because the patient has a C. diff. Patient is constantly pooping, their potassium is on the low side. But again, the patient has edema, the patient has been scheduled, or the patient has been prescribed Lasix. It's going to be up to you to be like, I need to double check. The patient is pooping. What are their potassiums like? Lasix is obviously going to drop their potassium. So you want to double check the potassium before you're actively going to go ahead and treat that edema in the patient. Because I can tell you that one of the life-threatening electrolytes in the human system is potassium. And so I feel like it's going to be better to prevent a drop in potassium as opposed to, pulling out fluid from a patient in terms of their edema. So always make sure that you are double checking yourself. Always make sure that you are triple checking yourself if you have to. Always make sure that you are questioning anything that you don't feel confident, or anything that you are not used to, anything that you have not handled before. Always double check yourself. Always ask questions. Always ask questions. Always ask questions. The next thing is going to be time management. Look, as a new nurse, I am guilty of this. I remember probably the first 3 months working as a nurse, I used to go home like 1 hour after clocking out, like the time when I'm supposed to be clocking out. Let me tell you something, new nurse, this is going to be very normal. I am not saying very normal in the sense that you should continue in the habit of, always leaving the hospital late, but you should know that it is kind of expected for you to be running behind things because, hey, like I said, you want to be asking questions, you want to be double checking yourself, and so all of these things are going to be taking time. One of the tips I can give you is, one, always make sure that you're clustering your care. This is what I always do. As a night shift nurse, after I have gotten report, I come again, I talk to the patient. Are you okay? Is there anything that you want me to bring for you? Since I've already written down all my medications, I already know, like, okay, this patient is here for this. Maybe the patient is here for abdominal pain. I just want to go ahead and ask them, hey, do you want any pain medicine because their pain medicine is due? Just to avoid me from going and coming into the room, giving their night medications, and then they're going to ask for, like, okay, I need my pain medicine now. You just want to cluster the care. If the patient is going to be needing maybe a urinal, if the patient is going to be needing anything else, just ask the patient whilst you're in the room. Do you need pain medicine? Do you need melatonin for sleep? Do you need something to help you go? I heard that you're having maybe indigestion. Do you want me to get to your Tums? There's this medication that was prescribed, Miralax, Senna, which is to help you go. Do you still want to take it? So that it's going to prevent you from not going to pull the medication and then going back to go return the medication. So always ask the patients these things before you are stepping out. Okay, maybe you've already sorted out the aspect of medication. Now you want to check, like, okay, is the patient's IV still working? Is it functioning properly? If not, then you want to actively know that, hey, when I'm pulling out my medications, when I'm coming to the patient's room, that's the time when I should be bringing my IV start kit. Hey, has the patient peed? Has the patient pooped? Then when I'm coming with my medications, I should just come along with wipes, chalks, and everything to keep the patient clean. If for anything you've checked and the patient's wound dressing is soiled, or maybe the ostomy bag is full and needs to be emptied or needs to be changed, you just need to collect all the supplies, walk into the room and do all of that. That is going to save you so much time. Time management is a very big thing for new nurses. Like I said, I am guilty of it. You don't need to feel like you're the only one who is actually running behind time. It is going to be normal for you. It's going to take time for you to be confident, to know what you're doing, and to ask less questions, and to triple check yourself, and in that sense becoming an expert in your time management. So I am not saying that you should continue in dragging on with your time when it comes to the care of your patients. Just always make sure that you're clustering your care. Always make sure that if you have to go into a patient's room, you're doing everything at once. If the patient is on isolation and you need something, just go ahead and get everything before you gown up and go into the room, just so that it's going to avoid you from sticking your head out and being like, hey, can someone please? What if there's no one outside there? Then you have to take off your gown, step out again, go get whatever you have to go get, come in, gown up again, get into the room. That is time wasted, and again, you have not even started chatting, and maybe the next medications are going to be due. You're just going to be running behind with so many things. You have to empty things, you have to chat things. There are maybe other things you need to do. Maybe if your day shift, your patient has been discharged, maybe you need to verify patients' medications, and if for some reason you have just 4 patients at the beginning of your shift and you're expecting one, and then that new admission patient comes on and you're still rushing and running behind time to finish up with just 2 out of the 4 patients you had earlier on, I can assure you that it's going to drag on with your time management. Make sure that you are clustering your care. Make sure that you are asking everything that the patient needs so that you can get them and come into the room. Hey, do you want water? Do you want snacks? Do you want juice? What kind of juice? Just ask some kind of specific questions, because I can tell you that sometimes it gets very annoying when you're going back and forth in one room, just because a patient keeps saying, I need this, I need this. Sometimes you are going to forget to ask all these questions, and the patients are going to keep annoying you by saying that, hey, I think I need my pain medicine. hey, I think I need this. And then, hey, you walk into the room, the patient's blood pressure suddenly is high. Or, hey, you walk into the room and something just happens and then you have to step out and come in. Always make sure you're clustering your care when it comes to the care for your patient, which is going to save you a lot of time. And this is the aspect of time management for new nurses. My very next thing is going to be know when to say no. Know when to cut off the line or draw the line for your limits. Let's say the patient care tech, the PCT or the CNAs are running behind time and they want you to help them to clean the patient, and you offer to go help them. And then another time they are also running behind time and they say, please can you take the blood sugar of another patient, whereas you're still chatting, you're like, okay, that's fine, I'm going to go get the blood sugar. And then for some reason you need to go take the vital signs for one of their other patients, and you're like, okay, let me just go do it. And then another nurse is yelling, hey, can someone please bring me an IV set or maybe a tube feeding or something? And then you're like, okay, yes, let me go get it. Let me tell you something. In as much as you want to become or make friends with as many nurses on the floor, just so that you can have that very good rapport or that very good affiliation with them, to be able to approach them and ask questions and to double check, and for them to be able to explain and teach you certain things. It is not that time when you want to be like the superhero. There are times when you have to learn to say no. There are times when you have to learn to be like, hey, I am currently doing something for my own patient, or I am currently chatting, I am running behind time. Just bring up something that is reasonable so that the other person who is asking for help can understand that, hey, you are not dispensable, or you're not available to help them with that certain thing that they are requesting from you. So always make sure that you know when to say, you know what, at this time I think that I'm very busy, I want to get ahead of time to chat, get ahead of time to do certain things for my patients, to clean them, to do their oral care, or to go get them their pain medicine, to start their IV, to start their feeding pump or anything. Make sure you know when to draw the limit, because you are not a superhero. We all know that we are nurses and we can multitask, but it gets to a certain point where you don't want to overstretch yourself, you don't want to over push yourself to your elastic limit, because that is going to create a lot of burnout. You're going to become that nurse that every time you're coming to work you feel so grumpy, you're always complaining like, oh my goodness, I left work so tired, oh my goodness, these nurses are always sending me, oh my goodness, these people are sending me around. Yes, they're going to send you around because you have put yourself in that position wherein they know that you're always going to be available to help them. If you make them to understand that, hey, now I need to catch up on my documentation, nobody is going to ask you that, hey, please can you, or nobody is going to ask you to do something when they know that you two are also struggling in terms of your time management. So always remember that we nurses, though we save lives, we are superhero in that aspect, but you have to learn to put a limit to say, hey, at this time I need to do this for my own self. If you get to that point where you need to step back, take a deep breather, relax, calm yourself, please make sure that you're doing so for your own mental health. I can tell you that the burnout in this nursing career can be very, very real, and it can catch up on you if you are not conscious of how go about the activities on your shift. The very last mistake that new nurses are very, very prone to making is keeping silent. If you feel like something is off, always voice it out. If you feel that gut feeling in you like, I don't think that this patient is okay, let me reach out to the provider, or let me ask another nurse what they think. Always follow your instinct. I can tell you that there have been so many times that we as nurses, our instincts have saved our lives. I remember there was a time when I had a patient, and this patient came in for alcohol withdrawal. Tell you what, this patient was so agitated, this patient was so anxious, wanting to just jump out of the bed, and no matter what I said, no matter what I did, the Ativan I was giving to this patient wasn't helping out. The patient's respirations were sustaining in the 33s, 35. The patient's blood pressure pressure was okay, but the patient's oxygen was dropping, even though I turned up the oxygen up to 15 liters of non-rebreather. And so this was when I had to call the respiratory therapist. I called the provider, and the provider was like, okay, I'm on my way. Guess what? When the provider came, immediately they came to the floor. This patient was whisked to the ICU. So always follow your gut feeling. If you feel like, oh my goodness, I know this is blood pressure medication, the patient's blood pressure looks maybe 110 now, but previously I was told during shift change that, hey, this patient's blood pressure was like a 90 and the map was maybe like a 59. Follow your gut instinct. Maybe if I give this blood pressure medication, the patient's blood pressure is going to drop. So it is going to be safe for you at that point to say, you know what, I'm just going to put it in there that I'm not giving, and I'm going to cover myself, like putting a note there stating that patient is prone to being hypotensive on blood pressure medication, and so at this time I'm going to hold off on giving this medication. But always make sure that you notify the provider, and you also write it on the note, provider has been notified. So always follow your gut instinct. I can tell you that your gut instinct in some cases is going to be God speaking to you, so do not ignore your gut feeling. If for any reason there is anything of safety concern for your patient, always speak up. If you are in doubt, ask another senior nurse. If you are in doubt, ask the charge nurse. If you are in doubt, ask anyone around you. Reach out to the respiratory therapist, maybe the physical therapist, or maybe someone on the floor. Just always ask and always follow your gut feelings. Avoiding these 5 mistakes will not make your shift perfect, but I can tell you that it's going to avoid your license being on the chopping block. In the comment section below, I want to know, which of these mistakes have you seen in action? Which of these mistakes have you seen another nurse actively get in trouble for, just because they did not step back and be like, let me rethink what I'm doing and actually make sure that my patient's safety is of paramount interest. Drop your comments in the comment section, which of these mistakes you've seen another nurse commit, what actually happened. Let us chit chat, let us share ideas, and I can always drop a few other mistakes that other nurses have made. Let us learn, let us share our ideas. I believe that dropping your comments in the comment section is going to save a new nurse out there from risking their license and from saving the life of a patient out there. My name is Stephanie. Thank you for staying on to the end of this video, and from me to you, I want to say thank you. Do not forget to like, share and subscribe, and I'll see you in my next one. Bye guys, and stay safe.